Hi, everyone. I'm Alexis Williams, founder of Business Skills for Health Professionals, and welcome to the Beyond Clinical podcast. In this podcast, I'll be interviewing health professionals from diverse backgrounds who've moved into unconventional roles beyond clinical. We'll be hearing their stories and tips and hope this inspires you to pursue unique career paths. This is episode 27 of the podcast, and I'd like to introduce my guest, Jennifer Buccino. Jennifer, can you say hi to everyone?
Hello. Hi, Alexis. Hi, everyone.
Awesome. Thank you so much, Jen, for joining. And I just want to share a little bit about your background. So, Jennifer started her career in the late 90s as a dietitian and soon became certified as a diabetes educator. She worked directly with children and their families with diabetes, cystic fibrosis, and other chronic conditions at SickKids Hospital in Toronto. At SickKids, she also led the dietetic internship program for students aspiring to become dietitians. After leaving SickKids in 2015, Jennifer focused on the profession, holding an executive leadership role with Dietitians of Canada, leading advocacy and professional development for dietitians in Ontario. In 2021, Jennifer joined Diabetes Canada to get back to her passion of helping people thrive with diabetes. At Diabetes Canada, Jennifer holds the role of Executive Director, Diabetes Knowledge and Connection. In this role, she leads a key team who help people with diabetes thrive at every stage of their journey by creating and sharing trusted resources, delivering practical programs, and fostering connection. On a personal note, Jennifer is married with two kids and enjoys skiing, swimming, biking, and running. And she's an avid reader, scrapbooker, and soap maker. Jennifer has lived with type 1 diabetes for 38 years and knows intimately the impact that diabetes has on one's life. So, yeah, thank you for that great introduction. And I like to start out with like a fun question, just unrelated to business stuff. Do you have any favorite podcasts you're enjoying at the moment?
Yeah. Well, thank you for the introduction, Alexis. One of the things in that introduction was sort of what I do in my spare time. And so soap making is one
Yeah.
of my crafty passions, if you
Mhm.
will. And so, not specifically podcasts, but I do spend an awful lot of time on YouTube trying to craft the perfect soap recipe.
Ooh.
And so I've come to learn lots around kitchen chemistry and how to make the perfect bar of soap through some of the stuff that I'm focusing on YouTube.
That's so fun. I feel like that just brings that scientific lens to
Totally.
something that's so creative, which is probably like just a great combination of passions. So,
Yes, yes. When
yeah,
my husband,
what's your
when the
best
box,
creation so far?
well, so actually, just recently I made a soap and I integrated three different colors. And so this lovely
Mm.
swirl, and I play with different scents. And for anybody who's listening who's done this before, like it totally is chemistry class. You've got your
Yeah.
oils all out there, you've got your sodium hydroxide that you're mixing, and you've got a whole chemical reaction. And just yesterday, a box arrived at the door, and I have new fragrances, and I have new oils, and a new scale. So I'm going all in on my passion, and gets me out of my day to day and any
Yeah,
lifetime stresses, really.
that's amazing. I feel like we all need something that we use our hands to kind of be creative with, and you can't be multitasking when you're doing it. So
Exactly.
that's amazing. Well, I'm a big consumer of fancy handmade soaps from artisanal artisans at farmers markets, so maybe I'll see yours
Yes.
one day.
Yeah, exactly.
Oh, that's awesome. So I'd love to hear about your health professional origin story and career journey, a little bit more in your words.
Yeah. Well, and again, alluded into in my introduction. So I am a person living with type 1 diabetes. I've had diabetes for um, 38 years. And that was the point of um, really deciding on science as a career, but also at dietetics. So as a young 13-year-old, newly diagnosed, I of course had a dietitian
Mm.
who I did not like.
Oh, interesting.
And it was a challenge. And as a young
Hmm.
kid who probably thought I know everything, I the nutrition aspect really was something I gravitated to, and also then knew that I have to know about this for the rest of my life.
Yeah.
And so it started me on this journey of, if I have to do this and think about this every day for myself, when everybody else, when I sit in clinic, has to do this as well, and working with a dietitian who we didn't jive at all, I thought,
Mm.
no, this is it. I'm gonna pursue this. And then thankfully, when I was 18 and sort of graduating from SickKids as a patient, the dietitian that I was then connected with was amazing. And she was young, and she sort of set me on the path of, where do you go from a program
Oh.
perspective, and what does this look like, and what does a profession look like? So I think what was sort of, a terrible situation in life turned it into something that I've been thankful for ever since.
Yeah. Oh, that's so interesting. I feel like it's always interesting when people go a little further back and tell me like, why did you even get into this profession?
Yeah,
Because I think
yeah,
we all have often like very personal reasons for making the choice to kind of be in like a helping profession and focusing on food. So
yeah.
that's pretty cool to hear.
I agree.
Is there anything that's kind of stood out? Because you've done clinical work, you've worked in more like business oriented roles, and now you kind of probably have a bit of all aspects of that in your current role. Is there anything that stood
Yeah.
out that's kind of contributed to your success in like learning the different aspects of what you've needed to learn?
Yeah, I really attribute some of the things that I have learned along the way to having had really great mentors.
Hmm.
I was thinking back at, in preparation for chatting with you today, to the time where, one of the mentors that I had at SickKids, who, you know, gave me an opportunity that I grasped onto and thought, I really don't know how to do this, but I'm going to try and do this. And so I've had really great mentors in my life who have, provided me that opportunity to experience things and to fail sometimes and
Hmm.
learn and grow from. And so I would say the biggest thing I attribute, any, if you want to call it success, because I still don't know what if it is success or not, is some of the mentors that I've been able to have throughout my career, that have, they've just paved the way for me, and they've allowed doors to open up, and they've allowed me to experiment a little bit. Uh,
Hmm.
yeah,
Well, I think it also says a lot about you because not everyone is willing to jump into those doors when they're opened. And sometimes people hesitate. And I think just from this is my 27th conversation with dietitians who've kind of gone out of the box, let's say. And a lot of them have said that similar thing that, they did something they didn't really know how to do,
yeah.
and maybe push themselves a little outside of their comfort zone, and had some support with it, but also must have had some internal like drive to do that.
Yeah, the biggest thing for me, I think, is, and I don't know if this is something that is innate or something that you learn along the way, but that curiosity,
Hmm.
questioning why. Why do we do things this way? How come we
Yeah.
do this way? And I don't know if somebody instilled that in me again, or if someone, sort of helped me grow that. But I do remember, when I was at SickKids, when I was going from really purely clinical to being a blend of, I'm going to do some clinical, and I'm also taking on this internship,
Hmm.
program management. Interviewed for the position. I was up against some, highly skilled people,
Yeah.
and what I learned afterwards was that I had presented a vision And I had presented not just answers, didn't just answer all the questions. I had said, well, here's the program and here's where I think the profession might be going. And here's where I think where we are and where we can go within the program. And it came back to me afterwards from one of these mentors who said, your ability to articulate your vision is different than what other people have said. And she was like,
Mm.
and the vision wasn't like we're going to change the world, but it was at
Mhm.
least a vision. And so to me, it's that curiosity, maintaining the
Mhm.
curiosity opens up those doors. And then having
Mhm.
somebody say, she might be young and she might be green, but you know what? We're going to take a chance on her
Mhm.
and let her walk through that door and then help her sort it out.
Yeah, I think there's an indicator in somebody who is curious. Like if you're in a leadership role and you come across someone that's curious, it shows an amount of bravery
Mm,
that they demonstrate that I think just makes you maybe want to take a bit of a chance on them because
yeah.
they're kind of willing to maybe be a bit brave. I don't know. That's been my
Yeah,
experience.
maybe.
Who knows? That's really neat. Well, you kind of answered my next question about the role of mentors and coaches and community. Is there anything you want to expand on with like how that's impacted your journey?
Yeah, I mean, it, sometimes it's a formal relationship, sometimes it's an informal relationship, but I think there's always something to learn from someone.
Hmm.
And again, I don't think I ever entered into any formal mentorship relationship, but when I saw somebody doing something really amazing and cool, and or when they were helping guide me in something, I just sort of like allowed it to happen. So I think it's something that I continue to do to this day,
Hmm.
and tap into the brains of the people that I've seen do really great things.
Yeah, for sure. That's a smart skill. Just like find the smart people and figure out what they're doing.
Yeah. Well, even the bouncing ideas off of somebody,
Hmm.
the moments where you're like, I'm stuck, I'm feeling stuck, I don't know what to do, I don't know where to go. But then being able to call up someone and say, hey, can we just have coffee? I need to get unstuck. I need to get somebody's opinion on this. And knowing that when you have those conversations that they're confidential, they're trusted, they're
Hmm.
and it's highly supportive. So
Yeah, I think there's a lot of value if you're in a role, in any role, to have maybe some external people you can that aren't part of your organization. I always found that was really important in my career.
mhm.
Having people that understood the sector enough that we could kind of talk the talk, but weren't directly in my day to day, like they weren't my manager or leader. And
Yes.
I think sometimes that's like a formal relationship, but as you said, it can also be informal networking and people you just meet throughout your career that you stay in touch with.
Yes. Yeah, absolutely.
Yeah, and I think that's a really powerful thing too. Like if you've moved through different places in your career, like utilizing things like LinkedIn and other networking tools to keep those connections
Yes.
as best you
Yeah.
can, and maybe reaching out every once in a while, although it's hard to
Yes.
find the time.
It's hard to find the time, but I do think it's invaluable.
Hmm.
It's as much a part of anyone's success as formal education and training,
Oh yeah, absolutely.
right?
Especially maybe even more so in non-clinical areas, I think.
Yes.
Yeah.
I think so too. I think so too. And sometimes I liked your point too about the somebody that's not within your organization, because sometimes when you're in the organization and in that culture, you actually need somebody else to say, maybe you need to be thinking about things this way and
Hmm.
reframing
Yeah.
ideas and thoughts for you that you haven't thought about, because in the culture
Hmm.
maybe you don't always get that. Maybe you're swept away in whatever's happening within the
Yeah.
organization.
No, absolutely. Did you find you ran into any gaps in knowledge when you were moving maybe like from the clinical role into like the work that you did with Dietitians of Canada or your current role?
Yeah. Well, I think I graduated back in the late 90s. And of course, I feel like it's like forever ago now. And so To me, it has never been one moment, and I've just sort of learned and built along the way. I do
Hmm.
remember though I'm not in my bio. It should be in my bio, but I did spend a year at Dairy Farmers of Canada as a
Hmm.
project manager, and
I think that might have been where I first met you, maybe when
it
I was
might have
at
been.
Loblaw. I think you were there then, maybe.
And I also I think we also met. I was doing a private practice,
Right.
um, and so what I when I left the clinical setting, and I really wanted to build on the program planning, the evaluation, the stuff I was doing within the internship, and so I was conscious of this is where I want my career to grow.
Hmm.
Hired on at Dairy Farmers of Canada in the Ontario team, it was the first time I had managed a budget.
Mm.
So they're like, well, here's your budget. And I was like, I don't know what to do with this. Like, what, how, how do I do this? And so, I think that was one moment in time where I was like, I don't feel like I have the skill set here. Of
Hmm.
course, everybody has the skill set.
Yeah.
You can manage your bank account,
Yeah.
you can manage your budget. And if you can read your own personal, P&L, you can
Yeah.
read your business P&L. So, but I did have that. I do remember thinking that I don't have the skills here. Why have they hired me? And then I thought, well, don't be stupid. You can figure this out.
Yeah.
So that was one thing where I think, you get that bit of imposter syndrome,
Hmm.
that, they didn't hire somebody that had this, economic background
Yeah.
or financial planning background. And so I dug in and I learned from, my manager at the time, what do I have to do here? How do I have to learn this? And then the other things I think sort of from a business perspective have grown over time, dairy farmers and then moving into Dietitians of Canada, um, being at the table when we talked about business planning and
Mm.
strategy development and how do these things all relate to each other. I feel like I got to sort of like observe along the way before I got to lead things,
Hmm.
in sort of more of a business mindset.
Hmm. Yeah. Well, I think you brought up a good point around like finance. That's obviously a lot of people I talk to feel a bit of imposter syndrome if they're ever in a situation. I went through this myself. Like, here's your P&L, and all these terms were thrown at me that I
Yep.
never really heard. Um, and, for me, I just kind of found a buddy in finance and like somebody I got comfortable with that I could just like take for coffee and pick their brain. And that was game
Yep.
changing. And I didn't do that right away. I probably went through a few years of like hiding and pretending that I knew what I was doing. I'm going to be
Yes.
honest. Um, but yeah, I think that's so important to like, not be afraid to ask a question that you might feel makes you look like you don't know what you're doing. And,
Right.
just being like transparent. Like, I'm not a finance person.
Yeah.
And I think that's so important if you are entering a role where this has not been part of it for you.
Yeah.
So,
Yeah. Well, I think the other piece is knowing where your strengths are.
yeah.
So, knowing that, early on, somebody had said to me, you seem to be a big picture thinker. You've presented a clear vision for this piece that you're working on.
Hmm.
I know that that's a strength of mine. And so then I can say, here's my strength. Here's what I bring to the table.
Yeah.
I'm good at finance. I get all of this now,
Yeah.
but it may not be the thing that I am passionate about. It may not be
Right.
the thing that I love doing on a day-to-day basis. And so, how do we work together?
Hmm.
I'm really lucky to have a really good finance partner within my current
Hmm.
job where I
That's
can say, can
amazing.
you just do this for me? Like, can you just like, I don't want to spend all the time. I just need to know that everything is balanced. So tell me what I need to know. And we've got a great working relationship.
Yeah. But I think that's just like that comes with a level of confidence that maybe you had to grow into over time. Maybe you had it from the beginning, but I do find that comes up a lot. Like people, the ability to ask for help and,
Yeah.
kind of be transparent that, this is not your strength but highlighting the strengths that you do have. And I think that's just part of when you're working in a business environment, like they didn't hire you probably because you're a business person. They hired you
Right.
for some other reason. So
Yeah,
yeah,
yeah.
it's an interesting
Well,
one.
That's such a good point because I do think, and I think this of myself, but I also think this of many people is that we're all, as long as we're teachable, as long as
Yeah.
we are able to learn, then it's more about a culture fit and a
Hmm.
personality fit and all of that than it
Hmm.
is. I mean, it's about your knowledge and your skills, but some things are very teachable. So I think
Hmm.
that we have to keep
Absolutely.
that in mind.
Yeah. So what do you love most about what you're doing now?
Well, so I've certainly come full circle, right? I started my
Yeah.
career, I have diabetes. I started my career in diabetes uh, close to 30 years ago. When I started, I was like, I want to be a diabetes educator. That's what I want to do. Did that and got to that point really early on. And so then, of course, moved away and meandered
Hmm.
away and back to diabetes. And I have to say, this is the job that tugs at my heartstrings on a daily basis. I get to see
Hmm.
the impact of what we do and how that
Hmm.
helps people with diabetes. So my current role, I oversee what's called knowledge and connection, but for all intents and purposes is programs and services directed to people with diabetes.
Okay.
So I oversee
Yeah.
our customer service line, I oversee our national camps program, I
Mm.
oversee all of our patient education tools and programs.
Mm.
And so we get that feedback about, well, how does this impact you? So that is amazing. And I get to work with wonderful people. My team is they're wonderful. They come to work every day because I think they're passionate about the
Hmm.
cause and they're passionate about people with diabetes being able to have access to tools and
Hmm.
um, knowledge to really live well. So I feel really blessed and
Yeah.
yeah, it's not all sunshine and roses, don't get
Of
me
course
wrong,
not. Yeah.
but I do get a lot of like personal meaning out of my current
Hmm.
job, and that's really important to
It's
me.
very motivating. And I
Yeah.
think it's probably like if you could think early on, like what would have been your dream? Like, I'm guessing this is probably kind of close to a career dream for you.
I mean, I have to say, like, because my dream at the time was I want to be a certified diabetes
Right.
educator and I want to be in the clinic. I did not see this. I would not
Oh,
ever have
interesting.
seen
Yeah.
this. The I could say yes in hindsight, but I had a very specific, well, here's what I want to do and here's where I want to go. That yeah, I don't know. I don't know.
Yeah. Interesting. Um, is there anything that you're working on right now to kind of further develop your skills, like any courses or programs?
So something I was doing when you and I worked together
Yes.
was the Certified Association Executive program
Right.
through the Canadian Society of Association Executives. So I just completed that actually, and I got
Oh,
my
congrats.
designation back last spring. And so for the listeners, it is really business skills
Hmm.
to be at an executive leadership position in an association or a not-for-profit organization. And it's really given me that foundation to sort of function at this level
Hmm.
because it is really truly beyond clinical.
Yeah.
And so that's been a bit more formal education for me to learn and grow into this position. And so now I just sort of like take what I've learned, and then
Yeah.
when there's a podcast or when there is an article around business development and strategy that sort of comes out through that. That's sort of the informal education that I'm doing to continue to grow my skill set.
Hmm. Yeah, that's neat. Well, that's a huge accomplishment. I know that program was pretty intense. So,
Yes,
yeah.
the final
Congrats.
exam was a killer.
Yeah, and I think it's such a specific, like it's so useful for the kind of areas you've been focused on, like
Yeah,
associations and you know those kinds of organizations. So that probably
totally.
is just very relevant, which I think is
Yeah,
so important this in this day and age. Like learning what's relevant to what you're doing just has so much more, just absorb so much more of it
yes.
than kind
Yeah,
of, you know, theoretical learning.
exactly. I agree. I agree.
Yeah. So is if there was one thing you could share with your early career self, what would that be?
To take more risks.
Hmm.
Even though I think I've taken a lot of risks, I think that there was probably more that I was and easy to say. So as you and
Yeah.
I probably know, so easy to say to my early 20-year-old self, take more risks, put yourself out there more, try and do more things. But that would be the advice I would give myself. I know now that if I was thinking I've got imposter syndrome, everybody else did as well.
Right. Yeah, you can see that when you look back.
You totally can see that. And so I think that's the advice, take the risks, take the chance, take the opportunity, find somebody that believes in you and can mentor you through your career.
I actually really love that point you said about imposter syndrome that, if you have it, just think about it's like imagining everyone in their underwear when you're presenting.
Right.
Like it's the truth. Everyone is feeling some degree of it. And I think
Yes.
if you can maybe keep that in your mind, it will maybe help you get through it a bit more easily.
Yeah, I think sometimes, and not specific to the dietitian profession, but there's this mindset of, I'll do that when I have the knowledge and the
Yeah.
skills. I'll get to that at some point in time. But all the while, the person next to you who doesn't have any more knowledge or skills than
Yeah.
you have is saying, I'll take it, give that to
Yeah.
me, and I'll muddle my way through until I figure it out. And that's, I think, where, that person that's put their hand up and said, I don't think I know all of this, but I can figure it out,
Hmm.
then those doors continue to open for that person.
Yeah. I
Versus the
100%.
person that says, I need to wait until I have that knowledge or skill.
Yeah.
And so that's it's hindsight. It's
Yeah,
as
I
many years.
agree. And when I'm talking to people in a kind of like more of a coaching capacity, I'm often trying to encourage them to think that way. Like I just had a conversation yesterday with a dietitian who was thinking about getting into an area, but it was like, well, I can't get into it until I take all these courses. And I was kind of like, well, yes, you can. Like you
Yeah.
can start. You just need to find some mentors and, like network a bit more around like who's going to support you as you learn this. So, yeah, I think it's easy to look back on that at this point in our careers, but I do think
Yeah.
it's a really great message because you're absolutely right. Like I can think of that similarly in my own career too. Like I did not know what I was doing on, multiple occasions. And I just kind of
Yeah.
figured it out in
Yeah.
time. So,
Yeah.
yeah,
Yeah.
that's
It's
amazing.
amazing what so many years do for you.
Yes. Any advice, like last advice to listeners who are kind of interested in finding a career, an unconventional career?
So I've already said so much, I'm sure. I think that the one thing that maybe we also don't give ourselves credit for is when you do have like you do have some knowledge and some skills, but you're trying to apply it to something different. So that my
Hmm.
advice is, think about where you want to go, if there is something you want to go to, and think about what you've done in your career that aligns with those skills that you need, because chances are you have it. You might not
Hmm.
have perfected it, you haven't developed proficiency, but you probably have elements that say, I can actually be a good fit here. So it's sometimes all how you sort of reframe things for yourself and reframe what your knowledge and skills are to get to where you
Hmm.
want to go.
Absolutely. I mean, this is a lot of what I talk about in my training, but like leadership as an example, or being good at sales, like you, as a dietitian, you already have those skills and
Yes.
you might not realize it, but you've probably heard on other podcasts me talk about some of those aspects that I'm very passionate about, but you definitely have those skills
Yeah.
and it's just a matter of like framing them slightly differently. And that can be sometimes how you get into these opportunities is kind of reframing a skill into applying it to a new situation. So,
Yeah, the other thing I would say, because I think we've all found ourselves in a position where, and I know I did at one point in time where I felt like I'd made a mistake,
mm,
is to think about what are you learning from this,
hmm.
right? There's always learning. There's
Yeah.
whether it's learning about yourself, whether it's learning about the career, and how are you going to use that to then
Hmm.
apply it to the next thing.
Hmm.
Again, totally easy to say this
Yeah.
many years afterwards. But I remember when I left the hospital, and I'll be honest with the listeners, Dairy Farmers was not necessarily the best fit for me. I have lasting friendships from that work that I had there. Um, and I learned a lot. But in the
Hmm.
moment, I was like, I have made a terrible mistake here. What have I
Hmm.
done? And then it wouldn't have put me in the position to learn what I needed to learn to be successful to get to
Hmm.
Dietitians of Canada. And then all the stuff I did at DC has then helped me learn and grow, and I've reframed it to be here. So
Yeah.
so even those opportunities or those times where you're like, oh God, that was a mistake, or
Hmm.
a project failed, or something didn't go well, there's always learning to be
Yeah.
had.
I agree 100%. Yeah, it's a journey for a reason. A career is not, you make different moves and sometimes things work out, but
Yeah,
you do take away something from each of those. So, yeah, absolutely.
yeah.
Awesome. Well, thank you so much. I hope everyone enjoyed hearing from Jennifer and you're kind of feeling inspired. So, just one call out if you love this show, please consider rating, reviewing it, and sharing it with a friend. And you can learn more about the services that we offer through Business Skills for Health Professionals on our website, which is bizskillsforhps.com. I'll put that in the show notes. And yeah, thank you so much, Jennifer.
Thanks for having me, Alexis. This was fun.
Yeah. All right. Well, bye, everyone.